Good day everyone, I am Myra Justin Bitinorian. Today I am going to demonstrate to you the procedure for assisting with ambulation using a walker. But before that, we are going to do an assessment, which is to assess the patient's ability to walk and the need for assistance, and to assess the patient's pain before the time of the activity, and also assess the patient's knowledge regarding the use of a walker. So since we are all set, we are going to start the procedure. So for procedure number 1, review the medical record and nursing plan of care for conditions that may influence the patient's ability to move and ambulate. And for specific instructions for ambulation such as distance. So assess for tubes, IV lines, incisions, or equipment that may alter the procedure for ambulation. Assess the patient's knowledge and previous experience regarding the use of a walker. So identify any movement limitations. So we are going to review them. So this is to assess for tubes, IV lines, incisions, or equipment that may alter the procedure, and for ambulation, and to assess the patient's knowledge and previous experience regarding the use of a walker. So by reviewing the medical record and plan of care, it validates the correct patient and correct procedure. So checking for the equipment and limitation helps minimize the risk for injury. So that's it. So now we are going to proceed to procedure number 2, which is to perform hand hygiene. Put on PPE if indicated. This is to prevent the spread of microorganisms. So I am going to use an alcohol-based hand rub. So for procedure number 3, identify the patient, explain the procedure to the patient, tell the patient to report any feelings of dizziness, weakness, or shortness of breath. So of breath while walking. So decide how far to walk. So by doing this, it validates the correct patient and correct procedure. So discussion helps reduce anxiety and prepares the patient what to expect during the procedure. So good day, ma'am. I am Myra Justin Bitinori, your nurse for today. What's your name, ma'am?
Andrea.
How's ang birthday, ma'am?
September 10.
Okay, ma'am. So for today, ma'am, we are going to do an exercise which is called ambulation. And we are going to use walker. So, experience ani, ma'am?
Yes, ma'am.
So, since you have already experienced using a walker, i-assist lang ka, ma'am. Okay lang ba sa inyo?
Yes, ma'am.
So, for procedure number 4, place the bed in the lowest position if the patient is in bed. This ensures safety when getting patient out of bed. So the bed is already on its lowest position. We are going to proceed to procedure number 5, which is to encourage a patient to make use of a stand assist aid, either freestanding or attached to the side of the bed if available, to move the side of the bed. So use of assistive devices encourages independence, reduces strain for staff, and decreases risk for the patient's injury. So for procedure number 6, let us assist the patient to the side of the bed if necessary. Have the patient sit on the side of the bed, assess for dizziness or lightheadedness. Have the patient stay seated until he or she feels secure. So having the patient sit on the side of the bed minimizes the risk for blood pressure changes or cold orthostatic hypotension that can occur with position changes. So, ma'am, i-cluster na ako imuntiin, ma'am, ha? Then, patakirid na ka, ma'am. Wait. So, hold still. So, ma'am, okay ra ka na? So, magkapad na, ma'am. 1, 2, 3. Okay ra. Dili man ka walay labad sa ulo, dili ka walay lain gibati, ma'am. So note that if dizziness occurs, immediately stop the procedure. For procedure number 7, assist the patient to put on footwear and robe if desired. This is to ensure safety and warmth. So ma'am, I'm going to put your footwear. Magamit ka robe, ma'am. So dili na no. So for procedure number 8, wrap the gait belt around the patient's waist. based on assessed need and facility policy. So now I'm going to wrap the gait belt around the patient's waist, but first I'm going to ask permission. Okay lang ba mag-put ko weight?
Yes, ma'am.
Gait belt, ma'am. So we are going to put. So gait belt improve the caregiver's grasp, reducing the risk for musculoskeletal injuries. So for procedure number 9, place the walker directly in front of the patient. So ask the patient to push him or herself off the bed or chair. So make use of the stand assist device or assist the patient to stand. So ma'am, we are going to stand now. 1, 2, 3. Yeah. So once the patient is standing, have him or her hold the walker's hand, grips firmly and equally. So stand slightly behind the patient on one side. So technically, you are going to stand on the weaker side of mutation so you can assist the patient properly. So proper positioning of the walker ensures balance standing within the walker, and holding the hand grips firmly provides stability when moving the walker and helps ensure safety of the patient. So positioning to the side encourages us to stand and walk around for the patient. So ma'am, I would like you to hold this firmly, ma'am. And so let us proceed to the next procedure, which is procedure number 10. Have the patient move the walker forward 6 to 8 inches and set it down. Make sure all 4 feet of the walker stay on the floor. Then tell the patient to step forward with either foot into the walker. So supporting him or herself on his or her arms, follow through with the other leg. This is to maintain maximum support that is required for patient safety and balance. So, ma'am, I would like you to move while holding the walker. So, okay, good. So for the next procedure, for procedure number 11, move the walker forward again and continue the same pattern. Continue with ambulation for the planned distance and time. So, ma'am, mapalangan ta ha. 1, 2, 3, 4. Okay, ma'am. So, return the patient to the bed or chair based on the patient's tolerance and condition, ensuring that the patient is comfortable. Make sure call bell and other necessary items are within easy reach. So, ma'am, we are going to put you back. So, this is the call bell, ma'am, ha? Butang na ako siya dali. So, by moving the walker, this promotes activity continuing for the planned distance and time and prevents the patient from becoming fatigued. So, I'm going to move the walker now. So, for procedure number 11, remove gait belts, clean transfer aids per facility policy if not indicated for single patient use. So, remove gloves and any other PPE if used. So, perform hand hygiene as proper cleaning of equipment between the patient helps prevent the spread of microbes and transmission and contamination of microbes. So, by doing hand hygiene, this prevents the spread of microorganisms. So, first we are going to remove the gait belt and put the patient in a comfortable position. Okay, ma'am. So, we are going to use an alcohol-based hand rub to prevent the spread of microorganisms. So, that's it for today. Thank you for watching.